Hi everyone. Today I am going to go over PCOS, which stands for Polycystic Ovarian Syndrome. We're going to talk about what it is, how you find out if you have it, some really great herbs that you can use to manage this, and also some good reading material. So I'm just going to jump right in. What exactly is PCOS? So again, this stands for Polycystic Ovarian Syndrome. And it's really important to understand that this is not a disease. This is just a series of symptoms that are going to affect your periods if you're a female. So you might be on one side of the spectrum or the other. So you will either have really horrible periods, so cramps, nausea, bloating, fatigue, heavy bleeding, or if you're on the other side, you might actually have really abnormal and a lack of periods, so you're not getting them enough. And I'm going to say we because I have PCOS. So basically, when I discovered that I had PCOS a couple years ago, I had really horrible periods, and I started to learn that I really needed to make sure and check women for this in my practice. And what I've found is that pretty much 9 out of 10 women that come in here that are younger, that have issues with their periods, actually have PCOS. So really what we're dealing with PCOS is an aromatization issue. This means that we're not properly converting our testosterones into estrogens. So we have a lot of issues in our cycles. But the good news is that this can be managed pretty easily. So ideally, if you are a woman that has the really bad periods, if you're managing this right, you can get to a point where your periods aren't so devastating on you every month. Basically, I've gotten myself to the point where I don't have to take any sort of, pain medication, or even I don't use medication, but I used to have to take a lot of inflammation and cramping herbs to help with my period. I don't have to do that anymore. I definitely can still obviously feel that I'm having one, but it's just not the devastating, nauseating, horrible thing that it used to be that made me feel so sick for several days of it. And then if you're on the other side where you're not getting them enough, this protocol should help you to kind of normalize them. So basically, first things first. So if you have PCOS, I really want to be very clear that not every woman will actually have the cysts. So if you're going to get checked for PCOS, you need to make sure that you're not just doing the ultrasound, the pelvic ultrasound, because a lot of times your NP or whoever's checking you will say, no, you don't have cysts. We don't know what it is. We don't think it's PCOS. And they'll usually just try to put you on birth control to normalize your periods, whether you're not getting them or whether they're horrible. Pretty much Western medicine's only solution for this is to put you on birth control. That's not really dealing with much. And we're already very sensitive to endocrine disruptors anyway, which is what birth control is. I'll get into that a little bit more later. But basically, it's really important that you understand you may not have the cysts and you still could have PCOS. So there are a lot of symptoms around PCOS, okay? So yes, you might have the cysts. You might have abnormal periods, lack of periods. Acne is a big one, facial hair, which is called a hirsutism. It also does affect anxiety, mood, weight, especially stubborn belly fat and the gut. So if I just said a lot of things that check a few boxes for you, that might be a PCOS indicator. So what every woman has in common, though, with every case of PCOS is that they have elevated testosterones, and it's not necessarily the free testosterone that's high, but it's the androstenedione level. So I really encourage everybody to get checked for PCOS using a hormone test. If you want to work with me, I just do this virtually. I'll actually send you this kit. It's an at-home hormone test. It's super easy. You just spit into 5 tubes over a 12-hour period, and I'll send you directions on how to do this, video instructions. But this gives me a lot of really great information. I get testosterone and androstenedione levels. We also look at all your estrogens, all your progesterone, and your cortisol, adrenal function, and melatonin. So women with PCOS also might have sleep disturbances because of their melatonin levels. So this test that I take really is holistic and all-encompassing to look at your whole hormone profile. So I really recommend that that's the number one thing you do is we want to get a test. Number 2, I really suggest that everybody read the book, if you find out that you have PCOS, to read the book PCOS SOS, and you can get that on Amazon for about $15. really great doctor who kind of specializes in PCOS. So she really does a great job of explaining what it is and doing a deep dive on what's going on in your body so you can really understand it. And she also talks a lot about some of the supplements that I'm going to mention today. She goes a lot deeper than I can in her couple 100-page book. But what I want you guys to understand is it's not a disease, which means there is no cure. So what we're looking at is managing this long term. Especially if you're planning to conceive at any point, it's really important that we normalize your periods, especially if you're not having them. So I kind of just want to go over what I do for PCOS and what I recommend. I am using the Skin Naturopathics brand, but I just want to be really clear. You don't have to use this brand. You can pull these products and ingredients from any brand that you want, or you can get these already kitted and ready to go at skinnaturopathics.com. So you heard me mention earlier that women with PCOS are really prone to endocrine disruptors. So if you haven't heard me talk about this before, an endocrine disruptor is something that goes into your cellular receptor site. So our cells are lined with these little receptor sites or kind of keyholes, and a hormone is supposed to plug into that and unlock some sort of communication functionality. And what an endocrine disruptor is something that looks like a hormone. So the cell lets it in, but it's not actually a hormone. So it doesn't turn or unlock anything. It's just sitting there taking up the spot of a receptor site that's supposed to be functioning normally, and now it isn't. So as an example, chlorine and fluoride and microplastics, those are all endocrine disruptors. So your cells think that they're supposed to fit in that site, lets it in, and then now we have no functionality there anymore, and the hormone system starts to go wonky. So it's very, very important for women with PCOS that we have to detox and clean that stuff out. This is the step 1 cleanse kit from Skin Naturopathics. So it comes with a skin detox, and I will put all of the ingredients on the screen as I do this, but this skin detox is actually working on cleaning out the blood and lymphatics. And then we have a colon cleanse, self-explanatory, that's going to go through and clean out everything in the colon. And we also have a kidney and liver cleanse. These are very important filtration organs. And really this is just going to get all of that junk out of the receptor sites and flush it out through these elimination channels. Really important to understand, this is a 1-month kit that you'll go through in a couple weeks, but I really want you to do this for the first 90 days, especially if you're not having periods. So you would run this kit about 4 times in the beginning for the initial. And that's actually ideal to do in the spring and the fall, especially if you live in a colder climate. If you live somewhere like Florida, you can start that anytime, but the reason for that is because in the winter we store up, so it's not the best time to cleanse if it's cold outside, but come spring, we want to detox all the things that we've stored that are not healthy. So spring is a great time to detox, and then fall, right before you're getting ready to store again, is also a great time to detox. Now, if you have PCOS and you're really suffering, get the kit and just start it at any time just because it's really important. But I just wanted to kind of talk about how ideally there are times that are good for the body to do certain things. Okay, so everyone's going to start with cleansing your body. Why? Because we're getting out the endocrine disruptors, and this will really help with the periods too, because actually when we're having our periods, that's a detox pathway as well. So by opening up these other elimination channels, it will kind of help alleviate period symptoms. However, we need to add some other things. So if you have the really bad periods, okay, this is not for women with lack of, but this product called Lighter Cycles, also through Skin Naturopathics, this is amazing. This has a bunch of herbs that are anti-hemorrhagenic. So it's not really going to affect hormone levels, but it's literally going to stop you from hemorrhaging so much blood so quickly when you're on your period. So it just makes your menstrual cycle a lot more gentle of a process on your body, and you're not going to have as much of that heavy bleeding those first couple days. This is something that you still have to take every single day, and you have to take it for a full 90 days to get the full effect to see a difference in your periods. Okay. The number 1 ingredient that every woman that has PCOS should be on is myo-inositol. This is a sugar alcohol, and it does a lot of things. Mainly it helps with blood sugars, which is a major issue with women with PCOS. We tend to have higher blood sugars because the body's not really metabolizing them properly. So the inositol helps go into the blood and work on those blood sugars, and it also actually helps with a healthy ovulation and hormone profile. So that is definitely highly recommended. N-acetylcysteine you can get from anywhere. This is the NAC Pro from Skin Naturopathics, and this works on keeping the liver detox pathway open. It also supports the tissues of the lung. So this is very important with women with PCOS, that we keep the detoxing happening and just supporting the health of the tissues. Metabolic Assist is great because women with PCOS are prone to stubborn belly fat. So this works on metabolism from the standpoint of blood sugars as well. And this also has some nice antioxidants in it. So it's really good for the cardiovascular system, and it's also good for microbial balance in the body. If you have any lingering infection, it just kind of helps keep all the good guys in charge, basically. This product called Inflam Assist, this is just a 50-50 split of curcumin and quercetin. And this is a high anti-inflammatory combo. So women with PCOS, we do have a little bit more inflammation in our bodies than normal women. So it's really important to be taking a high dose anti-inflammatory. So you'll take 4 of these a day. This product is a little bit more expensive just because it is a 120 cap kit. So this will last you a full 30 days going out 4 capsules a day, taking 4 capsules a day. This last one called Andro Assist, so important. So andro is in androgens. This is a combination of herbs, and I'll put all the ingredients up. And this is going to help push down that testosterone level. So really going to help with the periods. If you have acne, this is a great one because it's the acne that's being caused by the higher androgens, which creates more oil in our follicles, which causes the breakouts. So this is just a really, really important staple. I mean, really all of these are for PCOS, but this is a big one. So hopefully this is helpful for you guys. Again, I work virtually. If you need any help with, figuring out if you have this or what to do for it, this is the main protocol. Obviously, if you work with me, I do customize things to your specific circumstance and to your lab results. But just in general, if you have PCOS and you want to go on Skin Naturopathics and buy this kit, take it for 90 days and you should experience a significant difference in your symptoms. So I'm just going to wrap that video up for today. Thank you guys so much for listening. Oh yeah, one more thing. I am going to go ahead and put up the Skin Naturopathics website and then my website, and I also do a free 15-minute consultation over the phone for anyone that is interested in learning more about the process of the hormone testing. Okay, thank you.